Hello and welcome to Health and Wellness Oklahoma. I'm your host Rick Heath, and with me today Dr. Todd Farris of the Broadway Clinic. Dr. Farris, thank you so much for being on today.
Thanks for having me on today.
Talk to us a little bit about your background and how you chose this career.
Well, my formal training is in chiropractic. I'm a chiropractor. I went to Palmer College of Chiropractic in Iowa. I got out in 1995, and I've been at the Broadway Clinic since 1998. I've got just a passion for health and wellness, and through the years I've really developed this love for BHRT and how it can help so many people.
Now that's bio-identical hormone replacement therapy.
Correct, that's what it is.
And how does that, as a man, how does that affect a man?
Well, testosterone for starters. That's one of our primary hormones. And as we get older, our testosterone levels drop, okay? And when that happens, we kind of lose who we were. And we have many, many testosterone receptors in our brain and our heart. And as our testosterone levels drop, a plethora of things start to happen to us. We start to lose muscle mass, we start to gain weight, or we start to, we head towards heart disease, we lose bone mass, we start to head towards dementia. Many of these things occur to us as our hormones diminish. But one of the main things is we lose our zest for life. We lose our libido. Our give-a-hoot factor goes out the window. And you've seen this. It's the grumpy old man syndrome. And what happens is that little period between your mid-20s to your early 40s, even maybe your late 30s, you still kind of weigh the same. Everybody steps on the scale and says, well, I weighed what I did 10 years ago, but your waist is bigger. So your fat's gone up, your muscle's gone down. And so testosterone helps keep us healthy as a male.
I want to find out more about BHRT. We're talking with Dr. Todd Farris at Broadway Clinic. We'll be right back after this. Dr. Farris, now I've heard a lot about this low T thing going around, and as a man, it really makes you think. How does that affect a man?
Well, like I said, testosterone is our primary hormone that keeps us really healthy as a male. Testosterone has become a really big thing in about the last 5 years, but testosterone replacement's been going on for years and years. But there's two kinds of testosterone replacement. A lot of these commercials for these low testosterone clinics are using a synthetic injectable, and then there's another group of clinics that are using a bio-identical, which is molecularly identical to what we used to produce, and that comes in more of a form of a cream or a gel or a pellet. And so a lot of men don't know the difference. They go in, they just, the friend says go here or go there or go here or go there, and they wind up at one of these clinics, and so they think, well, this must be best for me. But I would advise any man who is not feeling like they used to, don't have the energy they used to, mental clarity's gone, drive's gone, libido's gone, get your levels tested, get your blood levels tested. And if you're low, supplement that with a bio-identical cream or a pellet. They're made by compounding pharmacists.
And we're talking with Dr. Todd Farris of the Broadway Clinic, and I have a lot more questions about low T and BHRT. We're talking to Dr. Todd Farris on Health and Wellness Oklahoma. We'll be right back after this. And welcome back to Health and Wellness Oklahoma. We're talking with Dr. Todd Farris of the Broadway Clinic. Now, in the last segment, you were talking about two different kinds of testosterone. There's a synthetic replacement and there's a bio-identical. What's the difference?
Well, bio-identical is just a fancy word for molecularly identical to what the body naturally produces. Synthetic is manufactured so that it can be patented. You can't patent something you can't patent a bio-identical hormone. You can't patent a hormone. And so in order to make money, you can change some chemical structure of the testosterone molecule, and you can patent it. The difference is bio-identical is molecularly identical to what we used to produce, and the body doesn't see any different between getting it from the outside or the inside. how we used to make it versus getting it from the outside. But most synthetics are injectable, and your body doesn't recognize that as its own.
How would a man find out more about this? I mean, you know, I'm curious about how, you know, the low testosterone affects me. How would a man find out more about that?
Usually their wives send them in.
Truthfully, yes. But, I mean, there's also different ways. There's tests or ways that you can find out.
Yeah, it's basically, we look at your blood work. We look at your blood work, it doesn't lie. It shows us where your levels of testosterone are, along with a lot of other hormones. And that's not the only hormone you need to balance for a male. There's, you know, you need to look at some DHEA, some thyroid. There's other hormones to look at, but that's the primary one. But we use blood.
So if you want to find out more, men out there, find out more about bioidentical hormone replacement therapy at Broadway Clinic, how would they do that?
Go to our website. There's tons of information on it, or they could call 528-1936.
I appreciate Dr. Todd Farris of the Broadway Clinic on Health and Wellness, Oklahoma. We'll be back next week with more on Health and Wellness, Oklahoma.